Hi guys, welcome back to my channel. If you are new, then welcome. Don't forget to subscribe. Yes, I'm looking at you, don't forget. Today's video is pretty self-explanatory, as you can tell in the title. This is going to be discussing the elephant in the room, the maths and science that comes into nursing. Now, it is unavoidable by doing nursing. You are doing a Bachelor of Science, so you cannot expect to get away with not being relatively strong in your math skills and your science skills. I mean, you don't have to be a genius, you don't have to know absolutely everything, but it is important to have your foundations, otherwise you will struggle. I'm gonna be completely brutal and honest. As we all know, there are so many different subjects that feed into nursing, like not just maths, not just science. There's like psychological, sociological aspects, there's chemistry, biology, everything. I'm kind of just going to give my thoughts on the science and maths elements of nursing that I've learned so far and what I think of them, basically, because one of the frequently asked questions I get is about this kind of stuff and how I find it, whether it's difficult or not. And a lot of people ask me about whether it's necessary to do like a science or maths A-level to get into nursing. No, it's not necessary. I mean, I would recommend that you do it. I personally didn't and I still got in, but it might help you. But if you don't want to do it, then you don't have to. You can still get in, it's fine, don't worry. Some of my book recommendations that have helped me through the topics that I'm going to talk about, I mentioned in a previous video that I've already filmed, so if you haven't watched that already, I'll link it in the description below. If anyone wants me to make any like quick teaching videos or like tips videos about teaching videos about these things, so help with like drug calculations or with anatomy and physiology, then I can do that. I mean, I'm not an expert obviously, but like I can try. So if anyone wants me to actually do like little mini teaching videos, please let me know in the comments and I'll think about doing that. So yeah, let me just get into this. The first kind of element of science that I found when I started first year was anatomy and physiology. Now the video that I'm linking in the description talks a lot more about that. But anatomy and physiology is basically just all about learning about the physical side of what is in your body, what is on your body, etc, etc. So learning about the layers of the skin, your vital organs, how your bones develop, your brain, your hormones, literally everything. And with children's nursing, that is a lot more complicated because the anatomy you're learning is not just one set adult anatomy. You're learning the anatomy of a fully developed adolescent, of a developing adolescent, of a child, of an infant, of a neonate. Like, there's so many things to learn, and you're not just learning the anatomy, you're also learning about the child development, and that's the more psychological side. So I guess that is still sciencey. I would say in terms of difficulty, I'd probably rate it like 5 or 6. Maybe. It depends on what topic it is, because some areas are a bit harder. Like for me, I find the brain really complicated, whereas other things I don't find as complicated, like the digestive system. I find that easier to understand than the brain. Don't ask me why. It's a good introduction to the biological side of nursing because they do go through everything step by step. It kind of is like a A-level-esque way of teaching in regards to like the content and the kind of level of difficulty, but if you've done your GCSEs, that's all you really need. That's a good foundation. If you have your GCSE sciences, it's a good foundation, so you don't need to worry too much about not knowing certain words or not knowing certain kind of biological concepts, because they do teach it to you as if you don't know anything. So like they'll explain what words mean, they'll explain how the systems in the body work in detail, because obviously they're not expecting everybody to come from a science background, so it is really inclusive. But yeah, difficulty wise, I'd say like 5 out of 10. It can be hard some days, it can be easy other days, but overall that side of nursing is really interesting and it will help you a lot in practice, so pay attention. And then with child development, that is really interesting as well, the more kind of psychological side and looking at physical development, motor development. That is a lot to remember because obviously there's a lot of different stages within like every few months there is a different development within the child. It takes a while to kind of get those things in your brain. I still don't remember everything. Like, it is going to take me a while to kind of keep that in here. I enjoyed learning about it at the end of first year. I thought it was really, really interesting. The second kind of science mathsy thing that I've encountered is drug calculations. Now, this is obviously something you cannot escape because it's something you're going to need to know for everything. Like, when you go on placement, you need to know how to do it because supervisors are going to get you to do it. They'll want to kind of help you with your calculation skills, and obviously they'll check it. They're not just going to let you do it by yourself because that's a risk to the patient. But they will ask you, oh, like, how much of this do we need for this child? And obviously you can check in the BNF, which is basically like a giant dictionary for medications. And depending on the age, if you get the children's one, there's an app that you can get on your phone called the BNFC. It's a blue app. You can download that, and it has all the drugs, and it tells you like what he'll give, the age of the child, the route of the drug administration, and like depending on the weight or the age of the child, how much of the drug they need. So you can check with that if you're not sure about doing things in your head. But the key to drug calculations is to remember the equation NHS, okay? With drugs, the calculation is what you need divided by what you have, and then if there's a solution, you times it by the solution that is in the bottle of the medication. That probably does not make any sense to you if you've never done drug calculations before, but don't worry because your teachers will teach you about that, and if anyone wants me to make a video about that in more detail, then I will. Need divided by have times solution, NHS, that's all you need to know. It's pretty easy. If you know your GCSE math, some of them are a bit more complicated, especially if you have to do like conversions from different units. It can be quite difficult, but overall it is more or less quite basic math. So in level of difficulty, I'll probably rate that like a 3. Maybe a 2, 3. Brush up on your basic maths and you'll be good. But you'll carry a calculator anyway, so if you can't do it in your head, or you're too tired, or you can't be bothered to do it in your head, just whip your calculator out and it's fine. And then the last kind of thing I wanted to mention is the demon itself, pharmacology. Now, pharmacology is something that most people study or start studying as second year, and obviously if you've been watching my videos, you know that I started the first few weeks of second year early because placements for first years got cancelled, so they swapped it over, so I'm going into placement at the beginning of second year, if that makes any sense. So I've just finished like doing the pharmacology module because I'm on my summer break now finally. But pharmacology, I mean, nothing can prepare you for pharmacology. Like, it is so interesting. If you don't know what pharmacology is, it is basically like learning about the routes that drugs take through your body, how they affect your body, how your body processes them, how it metabolizes them, how it gets rid of them. And you learn about the pharmacology of different medications in different parts of your body. So like brain medication, cardiac medication, renal, just everything, like all the kind of important things. So you'll become familiar with a lot of names of drugs, what they're used for, and that is something that kind of comes with practice, because the more you're in placement, the more you are exposed to different drugs and you ask your supervisors what they're used for, and the more confident you'll become on knowing like the different names, and you'll just feel more confident with what you're doing. But that comes with time. All of this comes with time, all of this knowledge. You're not gonna learn all of it at once, and especially with pharmacology, it takes a lot of revision, a lot of repetition, a lot of practice that I still need to work on anyway because I'm new to it. Nothing can really prepare you for it. Like, it is very difficult. Obviously it would help if you did do a science at A-level, but that's something that I didn't do, and I do get the gist of it, but it is a lot to take in and it's not something that you do remember instantly. So I'll probably rate that, the difficulty of that, maybe like a 7 or an 8 because it takes a lot more practice and it takes a lot more kind of revision to get it in your head than anatomy and drug calculations. So yeah, I would say that's probably the most difficult. And obviously because it's very kind of chemistry and biology related, those two together are a very difficult combination to wrap your head around. So yeah, as long as you just take the time to practice and you don't stress yourself too much about remembering everything at once, then you will be totally fine and you don't have to stress yourself too much about knowing things. So yeah, that's kind of all I can speak on so far about the scientific and mathematical aspects of nursing. Obviously I've got a lot more to learn, I've got a lot more to revise, but that is how I feel about it anyway. If you have any more questions or anything like that, then leave them in the comments below. As always, thank you for watching, and I'll see you in my next video. Bye.